Welcome everyone to UW-Eau Claire's faculty academic staff. Delighted to see so many people here today. My name is Erica Benson. I'm the Executive Director of the Office of Research and Sponsored Programs, and I have the pleasure of introducing today's speakers. So Angela Jones is an assistant professor in the College of Health and Human Sciences, Department of Teacher Education. She earned her Ph.D. in educational leadership from the University of South Florida and holds both MS and BS degrees in learning disabilities and emotional disturbances with a specialization in early childhood special education and early intervention services. Becca Jarzynski, excuse me, we were just talking about how to pronounce her name.
Perfect.
And is an associate professor in the Department of Speech, Language, and Hearing Sciences. Prior to joining UW-Eau Claire, she worked for 12 years as a pediatric speech language pathologist, providing early intervention services through Wisconsin's Birth to 3 program. Her clinical and research interests include early intervention, family-centered care, culturally and linguistically responsive assessment and intervention, and autism spectrum disorders. Becca teaches in the areas of early intervention, childhood language disorders, cultural and linguistic diversity, and research methods. And in their talk today, Dr. Jones and Dr. Jarzynski will share findings and recommendations from a collaborative project between Wisconsin's Birth to 3 resource team and UW system faculty that examined challenges and facilitators of family assessment in early intervention. Before I turn things over to our speakers, I want to note that we will have time for questions and discussion after the presentation. So encourage you to be thinking about some questions you might have. And for our viewers on Zoom, we want you to participate as well. So please use the Q&A function at the bottom of your screen to enter your questions. We have a fabulous graduate assistant, Ethan, who will read those questions aloud for us. So please join me in giving a warm welcome to Dr. Jones and Jarzynski.
All right, thank you for having us. We're looking forward to sharing all of this with you and hearing your questions. So just a brief overview of what we're going to do. We'll talk through, just give you some context about early intervention and family-centered assessment. Then we'll talk about the research project we did and the collaboration. And then we'll share the focus group findings. So we'll share specifically about current family-centered assessment practices within the state of Wisconsin. And then we'll talk about how that information is being used to reimagine family assessment within the state of Wisconsin. So again, just context first, early intervention is a program that is designed to provide services to children between the ages of 0 and 3 who have delays and disabilities. And practitioners that work within early intervention include special education teachers, speech language pathologists, occupational therapists, and physical therapists. Nationally, early intervention is governed by IDEA, or the Individuals with Disabilities Education Act, Part C. So IDEA Part C requires that early intervention is provided within a child's natural environment, that it is focused on supporting child participation in natural routines, that services are planned in collaboration with the family, and that services are designed to support a family's ability to support their child's needs. And really all of that is to enhance child outcomes, child developmental outcomes. So within Wisconsin then, early intervention is administered by the Department of Health Services, or DHS. And in Wisconsin, it's called the Birth to 3 program. DHS 90 is the administrative code that outlines how Wisconsin implements IDEA Part C within Wisconsin. And within Wisconsin, there are 72 local county teams that each have an early intervention program. So these county programs provide early intervention or birth to 3 with state oversight. And then last thing to know is that DHS, or the Department of Health Services, contracts with Wisconsin Resource to provide professional development to the EI workforce. So you'll hear us talk about this collaboration with Wisconsin Resource, or Wisconsin Resource PD, and that's what we're talking about. Okay, so within early intervention, we think about assessment, right? And we think about both child assessment and family assessment. This project was, the lens of this project was looking specifically at family assessment. So family assessment, contrast with child assessment. child assessment is focused on understanding the child. So really understanding the child's strengths, deciding if they qualify for services, describing the challenges and the routines of the child, whereas family assessment is more focused on understanding the family system. So when we're doing family assessment, we're seeking to understand a family's priorities, their values, their beliefs, their culture, their strengths, their challenges. And obviously these two things go together. You really can't understand a child without understanding the family. But again, the lens for this project was family assessment. So then family assessment is situated within the context of family-centered practices. Family-centered practices are really the cornerstone of early intervention. They're used throughout the early intervention process, from intake to assessment to intervention to transition out. We should be using family-centered practices. So when we use family-centered practices, what we're doing is prioritizing the family's role. We're really seeking to understand the family's unique strengths and priorities, to honor and integrate their culture and their values and their beliefs and their lived experiences into the services the child is receiving. Family-centered practices also require us to be relational and participatory. So we need to be executing services within the context of relationships with the family. And we need to make sure that the family is participating in active decision-making on behalf of their child, again, throughout the whole EI process. So family assessment then allows us really to be family-centered. We really can't achieve family-centered purposes without doing family assessment. And so then broadly, again, family assessment is really iterative, and it happens throughout the entire early intervention process. More specifically speaking, we have this idea of family-directed assessment. So we've defined that for this project as the family assessments that occur at very specific points in time, usually at the initial assessment, and then perhaps 6 months later when you do a review of the child services. So there's these very specific points in time at which we do these family-directed assessments. And those family-directed assessments need to meet criteria established by DHS 90. So they need to be voluntary, directed by the family, completed with both informal and formal tools, along with interview, completed with the choice of assessment tools, and at least per DHS 90, they need to be completed, or they could be completed with the family doing it by themselves or in collaboration with a member of the EI team. So that's the family-directed assessment. But again, the overall idea, the construct of family assessment is broader than that. All right, so then this partnership that we're going to talk about is part of a broader partnership that exists between Wisconsin's higher ed program and then higher ed programs, and then Wisconsin Part C birth to 3 programs. There's a number of things that are happening within this broader collaboration. Specific to this project, we worked with 4 members of that Part C professional development team that I had mentioned. These are the 4 members of that professional development team. And then there were 4 faculty researchers that worked on this project as well. So myself and Angela and Gigi from Madison and Pam from UW-Stevens Point. And there were really 3 factors that led to the development of this current research project. The first one is that this PD team back in 2022 completed a number of workforce surveys and engagement sessions and regional forums. And what they found is that there were inconsistencies with terminology and practices related to assessment broadly. So both with child assessment and family assessment, there was quite a bit of inconsistency within the field. And then they also found, specific to family assessment, that there was a wide variation in tools and practices related to family assessment. So a lot of variation in how family assessment was being completed across the state. And then this PD team also had this really clear desire to use research to inform practice. And so there was some ARPA funding that was available in 2021, 2023 that was used to create this research to practice team that was really designed to bring evidence-based practices or research into the practices that were being used within the state. And that's really where we entered into the picture.
Yeah, so the research questions that came out of those findings from the workforce and the needs identified in the workforce were to understand the recommended practices related to family assessment and early intervention, to understand how family assessment is currently being used in Wisconsin's Birth to 3 program. And overall, the purpose of this work is to drive the development of a framework that can guide Wisconsin's family assessment practices. And so there were different kind of steps within this process that we completed as a research team. So to address the first research question, we conducted a literature review along with a policy content analysis. We then conducted focus groups of the workforce. And now we are approaching that final step in terms of developing that framework. So what we're really going to focus in here is on those focus group findings. And so just to kind of illustrate this work, so we started, gosh, 2 springs ago now, in terms of developing a vision, a research proposal, securing that grant funding. And then last summer, we conducted the policy analysis and the literature review. Last fall, we conducted the focus groups. We also have been conducting some family interviews, and that part of this project is still ongoing. And then last spring, we analyzed the focus group data and presented those findings last summer. So just to real quick kind of catch up in terms of like, what is the literature saying? When we dug into the literature review 2 summers ago now, we were interested in identifying what is happening in other states, what practices other states are using, what the legal mandates say, what the research in the field recommends. And then also we pulled from professional organization recommendations. And what we found was that the terms related to family-directed assessment and family assessment are often used interchangeably, both in research and practice. And there's no clear or consistent definition of family-directed assessment. Additionally, we found that the relationships between child assessment and family assessment continue to be unclear in practice. The and well established, though the laws direct is assessment in the law is defined as like a specific point in time with a tool in an interview. It is also perceived in practice and the literature as an ongoing process. So we kind of have these kind of competing definitions and conceptualizations of what it is. And ultimately, when the family-directed assessment is conducted, the law requires that it involves both a formal assessment tool along with a family interview. And so part of the questions from the workforce is, what does that look like in practice, and how does that fit within our family-directed practices? So to dive into perceptions of the workforce, we conducted some focus groups. So last fall, we attended 3 different professional development events across the state, and we're able to meet with some of the workforce actually, we did 4 focus groups at 3 different events, and then we had a 5th focus group that met online. We had a semi-structured protocol that had 7 main questions, but also responsive conversation as well. And then we transcribed the focus groups and utilized a qualitative thematic approach to identify the patterns, themes, and insights across groups, paying particular attention to the alignment between family assessment practices and the recommended practices in the literature. We had altogether 26 participants, but it's important to note that several of the participants had multiple roles within their job. So they might be a service coordinator and an SLP. They also might work in multiple regions. So they might work in the North region and the Northeast. But we try to get a sample from across the state and across disciplines. And so coding of the focus group transcripts revealed 4 overarching themes that illustrated how the participants' experiences, practices, and perceptions of family-directed assessment either aligned with or diverged from the recommended practices. And that's illustrated here in this graphic. So each theme captures the different aspects of family assessment practices, and it identifies the what, when, where, and how of the assessment process, as well as participants' beliefs around those practices. Additionally, we identified barriers and facilitators of effective implementation of the family assessments that occurred within and across these themes. So we'll go through and unpack each one. Go ahead.
Yeah, so the first theme that we found was family assessment as an optional requirement. And this had 3 sub-themes within it: dissonance, divergence, and adaptation. But this broader theme really captures the way that participants or practitioners grappled with what they believed family assessment should be and how it actually played out in their daily work. So dissonance reflected the perceived conflicts that practitioners felt as they really reflected on their attempts to engage in this relational, participatory family assessment within the constraints of the system where they worked. Right. So they talked about tensions, especially between the medical model. So many of the practitioners work within rehab companies that contract with the county teams. So they talked about the tensions between this medical model service delivery and then this social model, the family-centered model that's really central to EI, and how things like billing and documentation really create tensions in actually executing family assessments in the way that they're supposed to be implemented. They also talked about practices that were established by the state. So things like how individualized family service plans were created, the processes for getting to individualized family service plans, or the way that the state conducts reviews to see if family assessment is being used, that those actually operate as barriers as well. And they talked about frustration related to this feeling that they were starting to shape their practices to meet requirements versus actually using family assessment as they knew it was supposed to be used. So that's dissonance. Divergence has to do with that variability in the way that family assessment is understood, implemented, and experienced across programs and even within programs among individual providers. So it matches the data that we talked about before, that there, and in terms of demonstrating that there's lots of wide inconsistencies across the state. And participants really talked about having this desire for more clarity, for more consistency in how family assessment is completed. At the same time, the third theme, adaptation, they also talked about how they had shaped and refined family assessment practices to meet the needs of the families in front of them or the communities within which they worked. So here they really spoke to this need for family assessment to be flexible and to be responsive to the family and the county. So there really is this tension that emerges between this divergence and adaptation. They're wanting more consistency and clarity, but they also are very clear in wanting to maintain the flexibility that's needed to be responsive to the families and the counties that they work with. So then the second theme is family assessment as a driver. So this theme overall highlights the transformative role that family assessment plays in shaping practices and really fostering relationships between the providers and the families. So 3 sub-themes here, all which speak to really the purpose of family assessment, or how practitioners conceptualize the purpose of family assessment. So framing, facilitating, and repositioning. Framing describes how practitioners use family assessment to embed early intervention within the context of a child's life. So the more they learn about the child's daily routines and the family's priorities and culture, the more they can weave practices into, or weave strategies into that child's day. facilitating really captured how family assessment also acts as this relational bridge. So it really lays the foundation for meaningful relationships between families and providers. So this sub-theme also really captures the bidirectional relationship between family assessments and relationships with families. So family assessment helps practitioners develop relationships with families, but also family assessment is contingent on or dependent on having a relationship with families. So those two things really grow together across time. And then repositioning captures the way that family assessment really helps practitioners to shift traditional power dynamics, put families in the driver's seat, and center early intervention within the priorities of the family. So it drives that shared decision-making that is central to family-centered practices.
Thank you. So our third finding or theme is this idea that family assessment acts as stories. And within this theme, participants described family assessments as a dynamic and evolving process. And so rather than relying solely on those structured tools, standardized questions that, those points in time for conducting the family-directed assessments, participants emphasized the importance of listening, flexibility, and the importance of relationship building over time. So this overarching theme of family assessment as stories reflects a narrative approach in which families reveal their experiences gradually in a non-linear and often in subtle ways. So within this theme, we identified three sub-themes: unfolding, emerging, and pausing. And within unfolding, this captures the ways that the participants perceived family assessment as a continuous and less formal process that occurs over multiple interactions. They often described having to return to conversations, having to revisit topics, and allowing time for that trust to develop. Emerging as a sub-theme captures the nature of these assessments and how participants emphasize the organic and relationship-based way that they gathered the information. So while they utilize those formal tools in those questionnaires, the information, like the critical information, often emerged through those casual conversations, through shared moments in the home as they're participating with the family through their routines and working with caregivers and their children. And it also captures kind of the culturally meaningful storytelling that happens within the context of the family's home over time. And then the third sub-theme we called pausing, and this captured some tension in the ways in which participants interpreted family silence or partial sharing. So there were several participants who noted that some families seemed to be reluctant or unwilling to fully disclose challenges or concerns, particularly early on in that relationship. And so while some participants framed this hesitancy as a matter of trust building. Others implied that families might be intentionally withholding that information. And so again, family assessment as stories kind of captures that, that organic and emerging process of storytelling in a nonlinear way. And our final theme, family assessment as reflective practice, captured the ways in which participants described family assessment as a space for reflection. And this reflection occurred on multiple levels: within providers, between providers and families, and within families themselves. Participants spoke about how they made sense of family assessment data, often contextualizing that information while they grappled with their own cultural assumptions and bias. So when we think about reflective practice, it occurs through their own professional development and also through families as they're engaging and reflecting through this process. We identified three sub-themes within reflective practice, and these are bridging, breaking, and building. So Participants described moments when family assessments prompted them to examine their own assumptions and biases in ways that expanded their understanding of the family's lives. In these instances, family assessment acted as a relational bridge, a way that participants engaged in self-reflection and kind of challenged their own biases in ways that allowed them to more deeply build collaborative partnerships with families. In contrast, participants also described moments when family assessment prompted some assumptions that reinforced some deficit-oriented narratives, particularly around what families were ready for. These moments of breaking reflected how reflective practice can inadvertently maintain some power imbalances and place the burden of the disconnect on families. And so alongside bridging and breaking, we identified building as a sub-theme here as well. And this is where participants described how this process supported the caregivers' reflections and how they saw this process as helping families to clarify their values, to recognize what they feel their child needs, and to name what mattered most to them. In these moments, family assessment functioned as a reflective scaffold for families and caregivers, facilitating meaning-making rather than just getting information at a point in time. So our next step in this process is taking these findings alongside findings from the caregiver interviews that are currently happening to identify and develop a model to guide the practice in Wisconsin. And so what we found through the focus groups and the literature review is the how, the when, the why, the with whom, that family assessment matters. And it highlights the need to move from the having family assessment in the program toward a practice that really integrates it as a dynamic and ongoing process that is rooted in both collaboration and reflection. Questions? Yes.
Could you talk a little more about how children become a part of this Birth to Three program? How that?
Yeah. Do you want to take it or do you want me to?
I can start and you can
Go for
add
it.
on.
Sure.
Yeah. So the question was how are children, how do they become a part of this Birth to Three program, right? So it starts with a referral. Referrals can come from anyone actually. So a physician might refer, a family might refer, anyone can refer to Birth to Three because they have concerns about a child's development. And then the referral would be made to the county. Every county has a program coordinator that is in charge of doing intake. And then from there, usually there's a screening process to decide if the child should receive an evaluation. If the screening process reveals that they should, then it's brought to the team. And from there, counties differ in terms of who goes out and actually completes the assessments at that point. But does that answer your question?
Yeah, I guess I was thinking about that. That definitely helps because I assume the families then make some kind of agreement then to be a part of the
It's an
program.
optional
and
program.
have-
Yep.
Yeah.
Mhm.
And so so that although they might be referred, they still have a decision about whether they are a part of the program. It's not something that's obligatory for them.
Mhm.
Right, yep,
Yep.
it's
Yeah.
voluntary, and it's voluntary to receive the assessment, and then even after their child qualifies, they should be asked, would you like your child to receive early intervention services, even after it's decided that the child would qualify? So, yeah.
So is that assessment, the family-centered assessment that you're talking about, that comes after a child qualifies for services, correct? That's not part of the process of parsing out or is it?
It kind of.
This was identified through some surveys and focus groups as a place of confusion because the law specifies that the family assessment happens after eligibility, before development of the family support plan. However, in practice, there has been some research to suggest that including that family assessment in that kind of initial eligibility process is really meaningful. And so there's a little bit of conflict between like specifically what the law is requiring and what practice, what research is finding is recommended for practice. So to answer your question, it could kind of occur either place, and right now that is a spot of inconsistency. So.
And to some degree, it depends on whether you're defining family assessment more broadly. I'm just trying to understand this family system, or whether you're thinking about the DHS 90 criteria, these point-in-time family assessments. Because theoretically, you should be getting to know the family system the minute you walk in the door, right? And part of that's, from my lens, is it's important to understand child development. You really have to understand the family's culture. So that you can situate your findings about what the child is doing developmentally within the context of what the family expects the child to be doing based on their culture. So, yeah. Does that answer your question? Yeah.
Was there anything that you found particularly surprising or unexpected? I'm really thinking about the focus groups. You know, you get people together and you ask them questions about their practice, and sometimes it's like, whoa. You know, anything like that came up?
I can think of just two things that, one is just how it shaped my own understanding of family assessment. I think that I broadened my own understanding of family assessment as I talked with practitioners, whereas I think originally my thinking was more constrained to those more point-in-time family assessments, and I learned a lot from them about how important it is that it is interwoven throughout the entire process and how they do that. At the same time, I was surprised when some participants talked about the way they did family assessment that was really very disconnected from the rest of the processes. So, for example, a program coordinator who's not going to be involved in actually providing intervention to the child might come in and do family assessment, write down all the answers, put it in the child's file, and then that information isn't actually used. And that surprised me to know that those things were happening.
Yeah, I think for me, I don't know if surprising, but I think what was most interesting is kind of the ways in which some participants talked about like, oh, well, you know, I'm just the SLP. I don't do the family assessment, you know, but then when we talk to them, you know, it's like, you actually are. You actually are. You might not be the one utilizing that questionnaire or that particular protocol, but the way that they talk about how they learn about families, the way that they talk about how they collaborate to identify the child's outcomes and to drive services is in fact rooted in these the framework of family assessments. And so yeah, I think that was kind of most interesting, the amount of participants who didn't quite realize they were doing it. A lot of them are already doing it. And I think the hardest part, or the most difficult part for the state to, as they're developing this new model, is figuring out how do we document what's happening, and what our providers are already doing well, and to create a system that helps to enhance that, as they move forward. So.
In a perfect world, is your goal to have like one cohesive plan that's used in Wisconsin? So all the children in Wisconsin are getting the same sort of tools, even though there would be monumental task.
So the goal is kind of consistency of practice, right? So, you know, as Becca pointed out in the requirement theme, that our practitioners kind of desire some consistency and guidance while at the same time also wanting flexibility. And so I think a lot of it is kind of finding that sweet spot that affords both, so that all of the kiddos who are receiving services and all the families who are being supported, it's done so in a way that is culturally responsive and uplifting for families, and also consistent where it can be.
And then just to add to that, that the systems that are used then within the state are supportive of that. Right?
Yes.
So aligning the systems to match.
Yes. Yes. The billing, the IFSPs, all the boxes you have to check.
Yeah.
So.